I'd like to make a quick announcement. Fellow YouTuber Paul Harrell. I'm sure a lot of you know of him. Paul Harrell he recently announced as himself. He was diagnosed with pancreatic cancer, which is not a very, very nice cancer. You have to get it very early, and it's very, very hard. Now, Paul also said in his video that he has an old acquaintance from like 32 years ago. He didn't say where she came from, girlfriend, coworker, but she's someone who is actively stalking him. And he warns us that everything we hear, unless we hear it from him directly, should not be listened to. Because he honestly believes the woman may, make a public announcement about him, being homosexual or some crazy shit. Now, Paul has said he will continue to work on YouTube videos as he goes forward with this endeavor. Obviously, you may see some weight loss from him. Obviously, you may see some hair thinning. But, yeah. And he said, I looked up pancreatic cancer. A lot of the symptoms are major abdominal pain that goes to major back pain, yellowing of the skin, darkening of the urine, lightening of the feces. You poop out lighter than normal, the coloring rather. Itchy skin, things of that nature. Now, those could be a billion different things, and if you have those things, you should see a doctor, but they can lead to, they can be symptoms of pancreatic cancer. And now, cancer can be survived. I'll use some examples. When I was a senior in high school, I came back in September from summer vacation. We go September to June where I live. Some guys go August to May. That's you. A friend of mine was completely bald, had a rag on her head. Now, when you see a bald chick, it either means she's a fucking psychopath or she's got cancer. My friend had cancer, and she survived it by the end of the year, graduation, and she had 3 more cancers. More on that later. Also that year, one of our security guards, who was an alumni, he graduated 98 years ahead of me in 92. He was out a lot my senior year. And we finally took him to a hospital, and they misdiagnosed pneumonia. Turns out pneumonia was actually lung cancer. On my birthday, one of my friends that we just saw, Steve, he's real skinny. He walked by, no hair. I saw Steve a couple of weeks later. He went from 240 pounds to 170 pounds. There was not hair on his body, and he could barely talk. He came back to visit. And there was a girl, she was a year younger than me. Her brother was a year older. He already graduated. He was the guy, the sergeant. He's coming down the hill, and I halt the traffic, and I save him from being T-boned, and he became a lieutenant. That's his sister. And I said, "Did you see Steve?" And she stopped and looked at me because she normally was my best friend. We butt heads a few times. But when she looked at me, she was like, I almost started crying in the middle of the fucking cafeteria. He eventually beat the cancer. Yeah. I came back to visit a year later, and I said, "How's your cancer?" He said, "I beat it." And they said, "Guess who was here not 5 minutes ago?" "Oh, Ralph. Ralph was my friend in my grade. He had stomach cancer." "Oh, he beat it too." "Oh, he beat it too?" Ralph died 2 days later. He came back to school to visit and told Steve he beat the cancer. He wanted to upset him, but he died 2 days later. So, now, my senior year of high school, I went to a little bit of physical therapy in an office building across from the hospital I was born at. And this is relevant later. And they have doctors' offices there, physical therapy there, shit like that. And then 2 years later, I had my ankle surgery. And I had to go physical therapy again there. Now, Steve had gone to that therapist for his back pains. Steve, the security guard. And the therapist was telling me, 2 years ago, I was telling her, Steve's still alive. He beat the cancer. She said, 2 years ago, he was in here with his back pain, And I said, get right to the hospital right now. And they re-diagnosed him with lung cancer. The original diagnosis of pneumonia was false. Dan, until you fucking saved his life. She said, no, I did. In '02, after the cast came off, my mother said, you got a lot of moles in your body. You gotta see a dermatologist. See a fucking dermatologist. Damn it, okay. So I saw the dermatologist down the hallway from the physical therapist office. Very old man. He was in practice for 40 years. He himself had a lot of physical problems, his knees and shit. He had to go to the physical therapy a lot of days after work. The same office the physical therapist, Delia, her name was. And he saw 2 things in my body. He cut them off. He said, I'm worried about these. I'm here now. Okay, you're here now, good. Laying your back. Beep, beep, cut. Sent up a biopsy. A couple years later, I stopped going. 2010, my sister's mother-in-law, I wasn't home studying for my college shit. I had studied my final exams. My parents were at my sister's house. She got hold on a gurney. She had enough cancer in her to kill 10 people. And we were saying this again today. They came to visit today, my sister. Or yesterday, it's now past minutes, yesterday. They think that her mother-in-law had cancer, but didn't want to tell anybody. Because she had enough cancer in her to kill 10 people, and how could the doctor be that dumb? So they believe that she knew she had the cancer, knew she was dying, and she may have told the doctor, don't tell my family. At the funeral, my brother-in-law's fraternal twin brother's there. He has a band-aid on the side of his head because he had a cancer lesion taken off. I hadn't been to the dermatologist in a couple of years. From the lobby of the funeral home, I called and made an appointment. That was 2010. It's now 2023. I have not missed an appointment since. The old man retired, sold his practice. The new guy came over, and the new guy said, hey, you had a moderate, what the fuck? He explained the levels to me. Moderate risk, these 2 moles in my chest, moderate risk is halfway to cancer. I was halfway to having a skin cancer on my chest at 20 years old. And I said, okay, listen, that's what to do. If it goes from benign to mild risk, I want it off. A year later, he moved upstairs to the 5th floor, from the ground floor to the 5th floor, much bigger office, took on a couple of partners, hired a couple physician assistants. I saw the physician assistant a few times, and I would see him or the assistant or the doctor, one of the other doctors. I saw one of his other partners last month, the day the school ended. And they basically said, yeah, you're good. One problem, the physician assistant a couple years ago saw something up here, he cut it off, no big deal. And I said, once it goes from benign to moderate risk, I want it off. Okay, there's benign, mild risk, moderate risk, severe risk, pre-cancer, cancer. Moderate risk is in the middle. Okay, that's where the chest was. Once it goes from benign up, I want it off. Hold on 1 minute, please. Allergies. Plus the humidity is heavy, hotter than fuck outside. Okay, so that's taken care of. Now, in 2023, skipping around a little bit here, my friend from high school had her 4th cancer. Now, many of you know Shannon Miller, Olympic gymnast. She had ovarian cancer with the same birthday. I got her booked for my birthday, our birthday a couple years ago. Well, Shannon was on the phone with her OBGYN. And, we were calling to confirm your appointment, blah, 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 blah. And she almost said, I'm busy. But I said, okay, I'll go. So I'll go. Shannon's 5'1", about 110 pounds. They found a baseball in her fucking ovary. What's it doing there? Well, let's look at it for a while. Let's look at it for 6 weeks. Her mother just had cancer. She survived too, her mother. Let's look at it for 6 weeks. For 6 weeks, you fucking kidding me? Another doctor. We'll look at it for 6 weeks. What the fuck? Third doctor. We're doing surgery. He almost had to lay on the table and do the surgery right then and there. So we're doing surgery. So it doesn't belong there. It's going out. They go to the operating room after they do, the appointed date. He gets on the gurney, tells her flat out, if I have to go in, I need permission to take both ovaries. Because he didn't want to revive her, sew up, revive her, get permission, and then go back in later that day or another day. I need permission now. She had 5 minutes to decide. She already had a son. She wanted more children. Yeah, she has permission. He goes in, opens her up. One ovary is fucked. Takes the ovary and the fallopian tube. When she wakes up, he's sitting at the bedside. He told her point blank, bad news, it's cancer. Good news, I saved one ovary and one fallopian tube for you. The other was garbage. And he told her, don't worry, I told my partners, we have this chemotherapy plan set up for you. He already had the chemotherapy set up for her. He had everything taken care of for her. She went to chemotherapy. It was a very, very lightened atmosphere. It wasn't like an execution. She survived. Had another baby, a daughter. Now, she's since traveled the country, speaking at cancer events, hospitals, charities. She's pretty much dedicated her life to this. And there's a picture of her, my favorite picture of her. There's a woman who's going for chemotherapy, and she's sitting down next to him holding her hand. And I told her, I said, listen, if I ever get cancer, your ass better be up here holding my hand. Yes, you're gonna kick me, but you gotta hold my hand at least. I said, so when my friend had her fourth cancer, I went on to do a cameo, which is a personal video that you pay for, and they do the personal video. Maybe I'll show it one day. Now, my friend is not a gymnastics fan, but she's a cancer survivor, cancer patient, and Shannon always wants to help cancer patients. So I figured, plus give her the money. She likes the money. And the video, I mean, she could have just got out of bed. It looks like she's outside, she's sitting down outside. It looks like I rolled out of bed, saw Vinny's request from him to do the video. That's how, she wasn't elegant, she didn't put makeup on. And it's actually a funny video because when she says my name and cancer in the same tone of voice. And when she says my name, you can actually see discomfort on her face because every birthday for how many years straight, I tell her she's old. And I make old lady jokes, old lady memes. And it's been a laugh, but she gets pissed off. Every once in a while, she'll get pissed off. Most times it's a joke. I always find creative ways to saying it. And I'm always joking with her about it. And she's like, Vinny, cancer. But she was great. She was great. She really was. And my friend beat her fourth cancer. Now, she was told that because of the fucking virus, she had to postpone her chemotherapy treatments until after the virus died down. And I said, yeah, they don't want you getting the virus. I'm like, what the fuck? But she fucking survived it. So a lot of cancer today can be survived. It's not always a death threat. So always go to your doctor. You should have a blood test once a year. A blood test can show cancer cells in the body. It won't diagnose cancer specifically, but it will show there's cancer growing in the body, and then from there they can go further. Okay? My dentist, first time I had him years ago, he says, grab my throat, my mouth. What the fuck you doing? I'm checking for cancer. My dentist is certified to check for cancer cells in the throat, mouth, gums, stuff like that. And I said to him a couple of years ago, without giving me too much information, you can't tell me a patient's name, obviously. Have you ever found? Yes, I have. He's found cancer cells in the throat and told the patient, go to the specialist and get checked out further. So a lot of times the doctor will be like, oh, fuck. This looks like cancer. Get checked out now. And the doctor will have a friend for you or someone he knows from college or from med school. This is my friend. Go to him. In fact, my barber, I might have told this story once before. My barber, he's still working. He's the last. One barber died. One barber retired, then died. Other barber retired. He's still working with new people. He's over 80. Well over 15 years ago, he had a tooth infection. Tooth was taken out. Another tooth taken out. He had like 3 teeth taken out. And one day he's cutting the customer's hair. And as he's cutting the hair, he's coughing a blue streak. He finishes the haircut. Customer, they knew the customer, obviously. He was a regular customer. He's a doctor. Go in the back room right this minute. Put on gloves. Flashlight. You have cancer in your throat. My friend is a specialist. Call him right now. Like, right this minute, call my friend. Right this minute. Save his life. Now, when my dermatologist, the one retired, the new guy took over. New guy's a Jewish Republican. Good. Okay. New guy took over. The new guy said that he had a patient. Obviously, he can't tell me the name. The patient's on the beach one day and on vacation. The guy says, yo, that thing in your back, that's cancer. Go to the doctor. They went to this guy, my dermatologist, cut it off, got it taken care of, okay? It can be survived. So we hope that Paul will survive it. He has to go through a lot of treatments. Okay, they have like cyberknife and other shit like that. This crazy new shit, they have technology. But we're hoping he can pull through. Okay, and like Paul said, he has an active stalker. And if you hear anything, it's either from him or it's not true. And there is no fundraiser as of right now. If Paul does a fundraiser later, he'll tell us about it. But as of now, he says there's no fundraiser. There's no GoFundMe, Give, Send, Go. So unless you hear it from Paul's mouth in his video, ignore it. Okay? So thank you.